September is Prostate Cancer Awareness Month. For men, prostate health no longer means an uncomfortable exam. A simple blood test can now spot early warning signs. In our Conquering Cancer story, see how knowing one number can save a man's life. For many men, the thought of prostate health brings to mind a reluctant visit to the doctor and the discomfort of a physical exam. But Dr. Tim Langford, a urology specialist with UAMS, says times have changed and now men can screen for prostate cancer with a simple blood test called PSA.
I think most men are afraid of is the prostate exam. It's not so much the blood work. And to be honest, the prostate exam is not near as important. In fact, we're not even highlighting it during prostate cancer screening now.
PSA stands for prostate-specific antigen. The blood test reveals a man's current PSA number. That number tells the doctor how much prostate-specific antigen is in a man's blood. Dr. Langford says men with no risk factors should begin getting a PSA test at age 50 and be looking for a number that starts around 0.
Generally, a normal PSA is felt to be 0 to 4. If it's elevated, that does not mean that you have prostate cancer. In fact, for men with an elevated PSA, if you biopsied all of them, 75% of the biopsies would be negative.
Scott Boggs is well aware of his PSA number. He's the general manager of the Searcy water treatment plant, but he's also a prostate cancer survivor. He says he began noticing some annoying symptoms years before his treatment.
I was around 50 years old or so. In my own mind, I thought I was way too young to have any prostate issues, so I actually ignored the initial symptoms I was experiencing for several years.
Boggs says he recognizes now that those annoyances were sending him a message, and eventually he did see his primary care doctor.
I had some urgency, and I'd get up in the middle of the night to go to the bathroom, and until it became a nuisance in my life. And then I spoke to my general practitioner, explained to him some of the problems I was having, and he and I came to the conclusion that we would make the PSA test part of my annual checkup.
Boggs continued the checkups and eventually says his PSA rose high enough it was time to see a specialist.
Hey, Dr. Langford, good to see you.
That specialist turned out to be a familiar face in Dr. Langford. Both men are from Searcy. With Boggs an active member of the care team, they decided to do a biopsy. The results confirming his cancer, but a slower growing type. It was 2018, a year where he lost his mother, received a promotion at work, and learned he had prostate cancer. He coped by restoring and riding dirt bikes, even entering a national competition. The pressure to finally act came from knowing he had another decade of work ahead of him. Boggs elected to have surgery. 6 months later, he says he's feeling great. And Dr. Langford says it's proof that knowing your PSA number can be a lifesaver.
Men, at least come in and get your PSA done. It's just a blood test.
Just a blood test, and we'll have a link to the UAMS Urology Clinic on this story on thv11.com, where you can find out more information and even make an appointment.